personally have like a use for medical marijuana. One of my best friends that I grew up with, her little boy has grandma mini seizures. And so instead of having like a full-blown seizure where it's like epileptic, he'll like literally walk and just like face plant and get up, and he has like no, like it don't stop. And so to me it was kind of important because he can have, I think the most that they ever counted in a day was 125. And then they got on all kinds of different medicines and like the common side effects of the whole prescription pills, like nausea, involuntary movements, upper respiratory, all kinds of crazy stuff. And the only thing that they could get down to was he had about like 70 to 75 a day. And they got the like medical, like the oil type stuff instead of like smoking. And he done like, I think it was half a gram a day. And then within like 2 weeks, he was down to like 6 or 7. And then after like 6 weeks, I think he has like 1 to 2 a week, maybe, if that. Medical cannabis also proven to treat and help symptoms of HIV and AIDS. And with that, anyone that like smokes it or does the oil, like it helps increase their appetite. It's been proven to reduce and almost eliminate cancer cells, any kind of pain, epilepsy for James, glaucoma and fibromyalgia, reduces the size and damage of strokes while improving neurological function in the patient. They said that people that like used on a daily basis, if they were to have a stroke, they did not have like the severe, like some people lose movement and muscle like memory. And they didn't have the, I guess, as a dramatic effect as if someone that was taking like 5 or 10 different kind of pain medicines to manage. And the only side effects that I found for any kind of marijuana is you're going to have higher blood sugar. That's pretty much it. Some of the downfalls of prescription painkillers is that they're super expensive. I think for one of James' medications, it was like $141 for 3 weeks. And it's not guaranteed to be covered by medicines depending on if it's generic or whatever the doctor signs them up for. They can have all kinds of nasty side effects. I think some of the ones that I found were like gastrointestinal issues, including nausea, constipation, diarrhea. Since most drugs go through the digestive system to be absorbed, other common effects include like drowsiness, pain, skin reaction, and the list is endless depending on the drug. And like the worst ones, I think he had like 2, that some of the highest ones were like stroke and death, was like some of these side effects. And then another thing is a lot of people that use, like they have a lot of high overdose risk, and if you take like a medication constantly, you're gonna if you get used to it, you're gonna have to increase on the milligram or increase on the prescription, or if it gets to where like Percocets no longer affect you, you go to something stronger. And so they try to say that like marijuana is a gateway drug. Some people that not a lot of people look at as far as using, I have a personal favorite actor that has fibromyalgia, and he was in a car wreck and he had like permanent nerve damage. And he's used for like, I think it was 3 years is what I read, and he said it's the only thing that he would do rather than doing painkillers for the side effects.
Yes.
Yes. And then the known, I don't want to say like pothead, but everybody knows him as a pothead, is Tommy Chong. And so he was diagnosed in 2010 with prostate cancer, and from 2010 to 2012 he never took a prescription pain pill for it. He only smoked marijuana. By 2012 he was completely cleared. Like had nothing, no trace at all. In 2015 or 2014 he got diagnosed with rectal cancer, and he's done the same method, and they had a little blog on him that on his last doctor's appointment he went to his checkup, everything was fine, it looked fantastic. This is kind of a lot. So 27,000 deaths per year on prescription painkillers. 52 million people over the age of 12 use prescription painkillers. 27 states have legalized medical cannabis, and in those 27 states, or 28 states, their overdose and death rates decreased by like 30% in a year. Prescription opiates are derived from the same sources and like that are used to make morphine and heroin. And so you taking a bunch of painkillers is like has the same side effects or similar side effects to the wonderful heroin and morphine. And then I thought this one was the craziest, that the U.S. citizens make up 5% of the world's population, but we consume over 75% of the world's like prescription drug category. And then I know that with you, you said that you didn't like the fact that it smelled. So you had the option to do an oils and like without having to have the scent and the odors. But this was my little presentation on why I would choose to put someone on medical marijuana over prescription drugs.
Gummies reduce the smell the most of anything. Like how they make the little like gummy treats and lifesavers and stuff like that. Any bit of the gummy stuff is usually less scented than any other, but if they make brownies or something, it comes straight out the smell, straight like. I'm sorry, I live in Colorado.
So which one blocks the screen?
Say it again?
Which one blocks the screen?
Oh, I got you.
Okay.
David, while you're pulling that up, I'm gonna run to my office real quick and get another pen. Mine's running out.